Hi, my name is Meghan Thompson. I'm at Memorial Sloan Kettering Cancer Center in New York, and I focus on the care of patients with chronic lymphocytic leukemia. So here at ASH 2022, I am presenting a poster looking at one of the higher risk patient populations in CLL and related disease Richter transformation. So we're looking at patients who have been treated with, it's a retrospective study with a non-covalent BTK inhibitor. So what these agents are is they're one of the newer class of agents that overcome resistance to the covalent inhibitors, drugs like acalabrutinib and ibrutinib and zanubrutinib, and bind at the same protein target, BTK, but in a different way. So these agents, at the meeting, there's going to be an update actually about pirtobrutinib, which is one of these non-covalent inhibitors, have been effective for patients with refractory CLL, but some patients have developed resistance to these agents and discontinued the inhibitor. So we're looking at these patients and seeing what the next outcomes after discontinuation of the non-covalent BTK inhibitor. And this is really the first retrospective look that looks at these patients and what treatments might be effective. And we really have no data to guide us here. But in the clinic, we're seeing these patients and are faced with needing to treat them. So I look at a bunch of different therapies. One of the main takeaways for these patients is that for patients who get a covalent inhibitor and then a non-covalent inhibitor and have not received prior venetoclax-based therapy, venetoclax shows clinical activity. And so this study is one of the first to show that. The other thing we found is that traditionally approved therapies, things like chemotherapy, chemoimmunotherapy, the PI3 kinase inhibitors do not have great responses in this setting. And so this is an area of patients that's an unmet need, and clinical trials are really important for these patients. We do have some preliminary data on CAR T-cell therapy, which there's short follow-up, but appears to be a promising strategy that should be investigated further. So overall, it's a very high-risk patient population, but for patients who haven't received the drug venetoclax, that's a good option, and that there's clinical trials ongoing with cellular therapies, including CAR T-cell therapies, that might be good options in this space. The other thing we do is we look at mechanisms of resistance in the patients with CLL who progressed on the non-covalent BTK inhibitor, and we're able to actually look at the genetics of the disease itself to see acquired mutations that occur in this BTK protein target. And so we present some updated data, and a majority of patients actually have an identified resistance mutation at the time that they progress on the non-covalent inhibitor.